If you are over the age of 60 and have always believed that walking is the safest and most complete form of exercise, it is important to understand that while walking can still be beneficial, relying on it alone may no longer support your body in the way it once did. Because as we age, the body naturally loses muscle mass, joint stability, reaction speed, and balance. And these changes require a smarter and more targeted approach to movement, especially if you already experience knee pain, hip stiffness, lower back discomfort, reduced stamina, or fear of falling. And this is exactly why many doctors, physical therapists, and surgeons now emphasize that after 60, the goal of exercise is no longer distance or speed, but strength, safety, and control. Because walking is repetitive, mostly forward-moving, and does very little to strengthen the muscles that protect your joints or train the nervous system to prevent falls. And in some cases, excessive walking on hard surfaces can actually increase wear on the knees, hips, and spine, which is why replacing long walks with low-impact, strength-focused exercises can be a smarter choice. And the first of these exercises is the chair squat, a simple but powerful movement that directly trains the muscles you use every day to sit down, stand up, climb stairs, and maintain independence. Because when the thighs, hips, and core are weak, even basic tasks become difficult, and chair squats allow you to rebuild strength safely by slowly lowering yourself onto a chair and standing back up with control, using your hands for support if needed, focusing on smooth movement rather than speed, which protects the joints while encouraging muscle activation. And the second exercise is seated marching, which is especially valuable for seniors with knee or back pain, because it allows you to strengthen the hips and improve circulation while remaining fully supported in a chair, lifting one knee at a time in a slow and controlled manner, which helps reduce stiffness, improve coordination, and maintain mobility without placing pressure on sensitive joints. And this is particularly important because poor hip strength often leads to balance problems and difficulty walking confidently. While the third exercise, wall push-ups, addresses one of the biggest limitations of walking, which is the lack of upper body engagement. Since daily life requires arm and shoulder strength for tasks like opening doors, carrying groceries, pushing yourself up from a chair, or catching yourself during a stumble. And wall push-ups safely strengthen the arms, shoulders, chest, and core without the risk of getting down on the floor, allowing you to adjust difficulty simply by changing your distance from the wall, making it accessible for almost every fitness level. While the fourth exercise, heel-to-toe balance walking, is one of the most important movements for anyone over 60 because balance is controlled not just by muscles, but by the brain and nervous system, and without regular balance training, the body becomes slower to react, increasing the risk of falls, which are one of the leading causes of serious injury and loss of independence in older adults. And by practicing slow, deliberate heel-to-toe steps while holding a wall or counter for support, you retrain your body to stay steady, improve coordination, and build confidence in movement, something walking alone rarely accomplishes. And the fifth exercise, standing side leg raises, focuses on strengthening the hip stabilizers that keep the pelvis aligned and the knees protected, because weak side hip muscles often lead to instability, poor posture, and increased joint stress. And by gently lifting one leg to the side while holding onto a chair or counter, you improve balance, protect the knees, and support smoother walking and turning movements. And the greatest advantage of these 5 exercises is that they require no gym, no expensive equipment, and no long workout sessions, as they can all be done safely at home in just 10 to 15 minutes, 2 or 3 times per week, making them realistic and sustainable for long-term health. And while walking can still be included for enjoyment, fresh air, and light cardiovascular activity, it should no longer be the foundation of your fitness routine after 60. Because true health at this stage of life is measured by your ability to move without pain, rise from a chair without assistance, maintain balance without fear, protect your joints from unnecessary stress, and live independently with confidence. And by choosing safer, stronger exercises that work with your body rather than against it, listening carefully to how you feel, progressing gradually, and consulting your healthcare provider when needed, you give yourself the best possible chance to remain active, capable, and independent for many years to come.